I'm Dr. Michael Haley. This is the DrHaley Show podcast. And today's guest is Rick Olderman. He's a physical therapist, clinic owner. He's also an author. He's a personal trainer, a Pilates instructor, a lecturer, public speaker. He's got a lot going on. But his most important work that we're talking about today is the series Fixing You, which is an online program that you can download and get well from your chronic pain problems using at-home physical therapy, and most importantly, figuring out what caused your problems to begin with so that it doesn't come back. Rick, thank you for being on my show today.
My pleasure. Thanks for having me.
We have a lot in common. I'm a chiropractor, you're in physical therapy, and, it's one of those things that I always looked at and said, man, these two practices together are probably the ultimate. But a lot of what you do is what the people need to learn how to do so they can do it at home. And if they really do it from the get-go, they'll probably never need people like me. So I don't know if I really want them to get this content out there.
Well, if they do it right, they won't need people like me either. And that's the whole point.
Yeah. And it's funny because from a chiropractic perspective, I look at my job as to look at the person as a whole, get things functioning more like it's supposed to, and teach them how to maintain that on their own. A little bit more than that, things we'll get into. And I know you're a fan of this because I checked out your work, but also help them identify the things that are getting in the way of staying well.
Exactly. And that's what I've been focusing on for these past 25 years. In PT school, maybe it's like this in chiropractic school, we are focused on understanding the structures that are irritated or, a rotated vertebra, a herniated disc, things like that, a strained tissue of some sort, and helping that tissue. But there's nothing that addressed why those things were happening. And I thought intuitively, as I entered PT school, okay, I'm going to get these answers, but they never came because that's not the medical focus. The focus is we're really good at testing and understanding the structure, but the whys, I never got any of that. And that played out after PT school. I was a failure with anything complicated like back pain or SI joint pain or sciatic pain, neck pain, headaches, things like that. Because I only had this more component training, I didn't have a more systems training. And that's what I've been focusing on. And so what I wanted to figure out was intuitively how we're using our body must have something to do with why we're having pain. And while, we give out exercises and things like that, they really don't get to the heart of how you're using your body that is creating that pain in the first place and to solve it. So that's what I've kind of specialized in doing.
Oh, that's awesome. Now, so for those of you listening, okay, we have a chiropractor and a physical therapy expert known around the world, helping people worldwide in your special program. Before we get into some of the details, I got some good questions because I want to help our listeners be able to take care of themselves and get rid of their pain problems. But why physical therapy for you? What happened that made you want to dive into this profession?
Yeah, well, when I was in my 20s, I suffered a really serious bout of back pain, knocked me off my feet. And then I was volunteering at a physical therapy clinic. And, that back pain went away, but then it came back again while I was in the clinic. One of the therapists noticed. He treated me a couple of times, took it away completely. I was just like, oh my gosh, I've got to learn how to do this. But a couple of weeks later, it came back again. And I kept thinking, what am I doing that's making this happen? And while his treatment helped me, it didn't solve the why behind it. And so I thought, I'm going to go to PT school to learn his tricks, but also figure out the insider secrets to all of this, right? Yeah. Well, those insider secrets never came. So, after PT school, when I saw how much of a failure I was as a PT, I kind of was sunk into a really deep depression for a couple of years there because I didn't know, should I continue this? I'm just not good at this. And, I didn't want to be one of those mediocre medical professionals, And so I decided, I've put a lot of time and money into this. I'm going to try and figure this out, which was a daunting project because people far smarter than me had gone before me and not gone down these roads. So anyway, it took me a while. I found my researchers who were researching areas, and I put all of this together and created what I do now. So that's short story how I got started.
And for those listening, you're going to have to listen to the end because, Rick is going to reveal a bit of a biohack. That is a way that you can actually learn to take care of things yourself for, quite frankly, less than a copayment of a single visit.
Oh, yeah, for sure. Yeah.
It's funny. I have a similar story. When I was about 20 years old, I was trying to move my apartment by myself, and those big couches with the pull-out beds in them. And think back to the 80s. Only this thing was probably 20 years old, so maybe even 60s or 70s technology. This thing was heavy.
Oh yeah.
And I was on the second floor by myself, and I had to move this thing, and I had to go down a winding stairwell. I thought, I could do this. And I just kind of bent over the whole thing. It was awkward. And I just yanked it over my head. And I got it over my head. And I said, this is not good. I realized I had done something bad. But since it was on my head, over my head now, I'm determined to maneuver it through the doorway, down the stairs. And I get back, to the downstairs, and my pickup truck is there. And I'm thinking, now I got to get that up there. And I've got, I don't know how much over my head still. And I almost get like a running start to get up on the back of my pickup truck, where I now go through the same motion in reverse that I tore something to begin with.
Oh,
well, things continue to swell up and get worse and worse. And I actually couldn't walk for about 8 months. I was away in college, poor, didn't have healthcare insurance or anything like that, and had to figure things out on my own.
Yes.
Now, 8 months later of, essentially stepping forward with my left foot and then catching up with my right foot, walking that way for about 8 months, I went to the gym and I decided, okay, the school clinic with their medications wasn't doing anything. I got to fix things.
Yes.
And working on myself, I realized there was a way to rehabilitate things. Within literally a week, I was 90% better, 2 weeks completely healed, and I could bend forward and touch my toes and walk normally. And, but at that time, I don't know if anyone listening can relate, you have a trauma like that. And especially at such a young age, you think, did I just get old?
Oh, yeah.
And we have these pain syndromes and we worry about them. We think, is there any hope? And that's kind of what this session is about. This discussion, there is not only hope, but a real strong likelihood that we can not only get you better, but find out what's causing it, remove the cause, and keep things well so that you can have that youthful playfulness, participate in sports, play tennis, or do whatever you do or want to do or wish you did or used to do. So Absolutely. That's what this time right now is about.
Yes.
Now, Rick, back pain, we had similar, but this branches out into ankle, hip, what other problems are we helping?
Head to toe. Neck pain, headaches are a biggie. And we can go into detail about how that works. Back pain, hip pain, knee pain, foot pain. So I've got a separate program for each of these areas. But of course, there's overlap in these areas too. So if you want to talk about back pain, I can give your listeners an example of kind of how I approach things. Would you like that?
I'd love that because, back pain, especially low back pain, is probably one of the biggest hindrances to people doing the things they want to do.
Yes. So here's a really easy test. Everyone can do this at home. So I'm going to ask you all to lie down on your floor or your bed or your couch with your legs straight. And go ahead and do this because you can hear my words and, hear what I say and it kind of makes sense. But until you feel what's happening, you won't really get what the connection is here. So go ahead and lie down on your floor, your bed, or your couch with your legs straight. Feel how your back feels at this time. All right, now we're going to compare that to now bend your knees with your feet flat on the floor. And if you prefer, you can have your knees hugged to your chest if that feels better for you. Okay, so one of these two positions feels better than the other. So for 99% of your listeners, it would be the one where the knees are bent or the knees are hugged to your chest. Would you agree with that, Dr. Haley?
Oh, absolutely. Yes.
Absolutely. Right. It's so common, right? Okay, so what is this telling us? What's the difference? What's happening to your spine that's different in these two positions? One is that your spine, if you straighten out your legs again, you'll feel that your spine is slightly arched, and then you're going to start to feel tension there. And when you bend your knees, you'll find that your spine is flat. And so there are fewer forces trying to pull it into an arch in this situation. So that's a real basic truth about your back pain, is that your back hurts more when it's too arched or there are too many forces trying to pull it into an arch. So how does this play out in what we do every day? Well, if you all now stand up and listen to the podcast and just stand there for a few seconds, I want you to notice, are your knees locked straight or are they soft? Most people will answer that their knees are locked straight. Okay. So now what I want you to do is unlock your knees, make them a little soft, and feel what just happened to your low back. And if you don't feel a difference, now lock your knees again, and then you will feel the difference. You'll feel that when you lock your knees versus having your knees soft, that your back is arched more, and you feel more tension in your back. And when your knees are soft, your back is flatter. You've removed some of that arching tension from your spine. So just softening your knees throughout the day for the next 2 or 3 days can have a huge effect on your back pain. We're removing one of those irritants to your back, which is you locking your knees when you're standing and walking. And this is what I'm talking about understanding how because that is an unconscious habit to lock your knees. Your brain thinks that you should be doing that, and that's why you're doing that. But what your brain doesn't understand is that is actually contributing to your back pain. So you've got to create a new and better habit to fix this. And that's what my program does. It not only, fixes the tight or weak muscles that happen because of these kinds of things, but it identifies the habits that typically cause these problems and teaches you how to fix them.
Yeah, that's pretty neat. And so you have similar hacks for other parts of the body, then I would imagine.
Oh, sure. Yeah.
And it's funny because going with the example that you just gave, I like to use a very similar approach. I'll have my patients stand up and I'll make them almost awkward in their posture initially and say, okay, bend your knees and have that bounce in your posture. At the same time, tighten up your abdomen and, tilt your pelvis a little bit so that you're kind of flattening out your back. Do you have more pain or less pain? And, 99 times out of 100, it's less pain. Okay. So what you did is you kind of put your leg shock absorbers on, in a sense, and at the same time you engaged your core, that protective mechanism for your posture and your body. Go ahead and stand back up and lock them up again the way you're used to standing. Okay, now move your knees just a half an inch forward. Just unlock them. You feel the core engaged. You feel the muscles. You got that core engaged. And a funny thing happens when they do that. Everything above them straightens up. Their forward head posture all of a sudden comes over their shoulders, and their whole posture changes because it's a foundational thing, from the bottom up. It's a beautiful thing, and it just helps them so much more. Now, so we're correcting posture as a possible cause. How are we identifying other potential causes to their problems?
Yeah. So when I examine people, there are always tight or weak muscles associated with these postures. For instance, let's go back to our standing example. When the knees lock, not only is it causing your back to arch more, but it turns off your butt muscles. Well, the butt muscles are the primary controllers of your hip joints, and they also control your pelvic orientation. They also control the rotation of your femur, your thigh bones, which then plays down into the degree of pronation and supination into your foot. So there are many consequences to a small problem, like locking your knees, has huge ramifications throughout the whole lower body and back system. Consequently, but if you solve a small problem, like unlocking your knees, it starts to turn on all the things that should be turning on the way they're designed to be turned on, and starts fixing problems up and down the chain as well, just as easily as it broke it down. And so that's the beauty of looking at things from a system standpoint, is that you can drop that stone in the water and see all the ripple effects going all the way to the shores. And that's kind of how it works in the body.
Yeah. It's funny you say that, because I don't care whether it's back pain, neck pain, ankle pain, cancer, eczema, psoriasis, irritable bowel syndrome. There is always a cause.
Yes, I agree with you.
And we can, chase symptoms and treat symptoms forever. And if we never get to the cause, it's going to keep coming back, whatever it is.
Absolutely. Absolutely.
Yeah. So I like how you're breaking it down and looking further than the pain, and, looking at the foundation and kind of a ground up approach. And, regardless of the health challenge, we have to figure out what the cause is.
Yeah. You have to think about your pain as that's where your weak link is. That's not necessarily where the cause is. That's just the weak link that's getting irritated and saying, hey, something's wrong. So figuring out the cause is a whole nother animal.
Yeah. I remember for years after my back injury, I remember having a challenge, and it would continue to come back occasionally. I eventually figured out what I call my triggers. For instance, for me, if I sit on a floor and lean forward, I'll feel great while I'm on the floor. But something slowly swells up. And if I spend too much time in that position, like, imagine sitting on the floor and trying to work on the garbage disposer, through the cabinet, leaning forward in that posture for a period of time. I go to get up. It's like, oh, what's going on? And, I remember, having a difficult time just standing in church and singing along with everybody else. It's like, God, why would you not let me be able to stand and worship you? Why are you making that difficult for me? I realized that there were certain things that I was doing. For me, my triggers were sitting wrong, and believe it or not, wearing a belt too tight. And, I realized some police officers sometimes have something called gun belt sciatica. The gun belt is a trigger for them, irritating their sciatica. There's driver's sciatica. Just the mere pressure on the gas pedal for extended periods of time can cause certain things to tighten up and be a problem for you. So we identify causes and triggers, not only avoiding those as much as possible, but there's also things we can do to strengthen ourselves and be able to do those things. Do we learn that in your programs?
Oh, sure. Yeah, otherwise I don't think I would be successful at solving pain, because that's really where the rubber hits the road, right? Is that you've got to fix how you're using your body, and you've got to understand what those things are. And if you don't, well, then you're kind of doomed to what you've been going through these past many years. It's just going to keep coming back. So if you don't mind, you mentioned sciatica. Can I explain to your listeners my take on what's happening with sciatica too?
Oh, absolutely. Please do.
Okay. I'm going to bring my little helper with me. I've got a little skeleton here. So typically, the pattern that we just went over first was called an extension pattern. Extension means arching. So that pattern is a very common one for back pain. But if you have unilateral back pain or sciatica down one leg or SI joint dysfunction, often what's going on is that one side of the pelvis has become higher and one side of the rib cage has become lower. And I call that a side bending problem. And usually when this happens, we get more compression on this side of the vertebrae, which then compresses the nerve roots exiting the spine that comprise the sciatic nerve. So this is really easily fixed. And if you've ever had an X-ray or MRI, you'll receive the diagnosis of a scoliotic curve. Scoliosis in medicine just means a lateral curve of some sort. It doesn't mean that you've got that congenital scoliosis. It just means that there's some kind of lateral curve going on in your spine. So there's scoliosis that you're born with, but so scoliosis can be functional too. It can occur because of how you're using your body. And in this case, what's happening is often that there is a problem in the same leg as the hip that's elevated. And the hip coming up and the rib cage coming down is your brain's way of getting off that problem. It's called a withdrawal reflex pattern. And that's what we're born with, these reflex patterns. It's hardwired into our body. And so when we step on a piece of glass or tack, we immediately hike that up to get off of it. That's part of the whole pattern of response. Well, our brain, as we grow, overrides those hardwired patterns, but they're still present in our body, and they're slowly operating to create this pattern. And an easy way to see if you have this pattern, especially if you have unilateral back pain or sciatic pain, is to take off your shirt and have someone take a picture of your back. If this has been going on a while, often what you'll see is a big crease on the side where this compression is happening, and almost no crease or a smaller crease on the other side. That means if you've got that crease, it means that it's been happening a while. If this just happened yesterday, then you won't have that crease. But that's an easy way to see whether you've got a side bending problem at the root of this issue. And if you do, the side bending problem is easy to solve. You can solve it in 10 seconds. But really what you need to solve is the reason why the side bending problem is happening in the first place. And almost always I hear from my patients, oh, that reminds me, it must have been that old knee injury I had back in high school, football, playing football or whatever, some old injury. They're just like, oh, right. Yeah, I never did go, get that rehab. So it just kind of went away. Well, it went away because you were compensating for it rather than directly rehabbing it correctly.
Yeah. For those that are listening on the podcast, imagine, Rick was holding up a spine and demonstrating that kink in your back, that same thing you would see if you had your shirt off and you were looking at yourself from behind. If you saw a crinkle on one side more so than the other side, of course, you got to have a little extra weight. You can't be fit and all in shape like Rick is, but it's accentuated in people like me. I got a few extra pounds on there. Well, but the point being, just like if you step on something sharp and you jerk your foot off the ground to get rid of that pain, those little irritations, he was showing how that same reflex, maybe to a lesser extent, but for a longer period of time, for like even years in some cases, are going to cause problems, and getting to the root of those. So imagine, you can see it on YouTube, by the way. It was a great demonstration.
Yeah. And so like from our professional training, we would see this as a problem. Oh, this is you've got a rotated spine, or your vertebrae are rotated. But in spinal mechanics, when you have side bending of a spine, it also creates rotation. And I don't know about you, Dr. Haley, but anytime I've tried to fix rotation, it doesn't really stick that well. But when I fix a side bending problem, now the rotation then goes away and it sticks, because the side bending is the battery that's driving the rotation, I found.
Yeah. The joints are so complicated. They don't just move, forward and backward and rotate one side or the other. But, when you have one, you have the other. They all work together.
Yes.
And if you can fix the problem, it's all going to work great.
Right.
Good stuff. Sometimes I have a hard time diagnosing the cause. I'll give you an example. Yesterday, new patient, and he had pain in his forearm, and he had been to a chiropractor before that, adjusted his neck to get rid of the pain in his arm, because it was a radicular problem caused by a kink in his neck, in a sense. And he figured, well, just to, adjust my neck and everything will be fine in my forearm. Sometimes we have a hard time diagnosing. And for me, I ran some tests and got some conflicting results. Mm-hmm. I couldn't tell if it was a radicular from the neck or a localized. For instance, as an electrician, maybe you turn the screwdriver too many times and you have an overuse problem in your forearm. Couldn't tell. How do you drill down and get to the cause?
Yeah, so that's a different system. I'm happy to show you what that is. So if we look at the body, we can see, if we look at the skeleton of our body, we'll see that we have a shoulder blade, and the shoulder blade is a broad, flat bone. All right. And there's only one other bone in the body that looks like this, and that's a pelvic bone. It's also broad and flat. The pelvis is the center of function for the lower body system. It turns out that the shoulder blade is the center of function for the upper body system. So often there are dysfunctional patterns that are happening with the shoulder blade. And there are really big muscles that attach from the shoulder blade into the cervical spine and the base of the skull. So when the shoulder blade is off, it transmits force via these muscles into the cervical spine, causing compression, side bending, and rotation of the cervical spine, and all sorts of irritation to disc herniations and so forth. That can easily cause ridiculous symptoms down the arm. But the source of the problem is not the neck, it's the shoulder blade. So the shoulder blade is also half of the shoulder joint. And if the shoulder blade isn't resting well, then the shoulder joint isn't operating well. Well, the shoulder joint is that arm bone is one half of the elbow. So if the shoulder blade and arm bone are affected, then the elbow isn't going to be correct either. So what I always do is I always start all of my exams looking at the shoulder blade, because that is the center of function for the whole upper body system. And then we go down the chain to look more closely at the elbow. So what I do is I solve problems concurrently, both in the shoulder blade and the elbow at the same time, which usually solves the problem. And in terms of the elbow, specifically, there are tiny muscles deep in the elbow called pronators and supinators. And what I have found, because our society, we're always on the computer typing, right, or mousing or things like that, when we turn our palm down, that's called pronation. And there are deep muscles that control that. So what happens is when we're like this all the time, those muscles then become overly contracted and shortened. And I have found that by stretching those out into supination with the palm up, solves a lot of elbow pain, especially in conjunction with fixing the scapula.
Yeah, that's good stuff. Awesome. So Fixing You, is that the name of your programs, regardless of the one they download? And what is Fixing You?
Yeah, so Fixing You was the name I gave all of my books when I originally wrote them back in 2009 and 10. And then I decided to stick with the name. And I've developed home programs that are downloadable that have streamlined everything that are in the books. And they also contain a lot more information, for instance, the ergonomics and fixing habits and taping recommendations and things like that. So those are the downloadable home programs that people can have to download their pain wherever it is in their body. And you can find that at fixingyou.com.
Now, someone that gets this program, how long does it usually take them to go through it?
Well, I just went over I just had a neck pain webinar last night, and the program for pain reduction there is it's about 25 minutes. If you can do 25 minutes a day, you should see significant results in your neck pain, probably within a week, or headaches or shoulder issues. And same with the back, because in the clinic, my standard was if I need to see 30 to 50% pain reduction after my first visit.
Yeah.
When I see that, it assures me that I'm on the right track. If I don't see that, I need to go down a different road and look at something else instead. And so that's kind of the attitude I take with my programs. You should see significant pain reduction very quickly within that first week for sure. But hopefully I even have you measure your pain after each session, because it should decrease even after one session of doing these exercises.
Right.
The thing about my program is that there are exercises to stretch and strengthen things that are wrong, but you've also got to fix those habits. So I've got a separate video for all the habits that typically cause these problems. And then I have an extra help video for taping techniques to support your body until you fix the things that need to be fixed. And it also offers practitioner help recommendations. So you can take those videos to your practitioner, say, hey, can you do this for me and see if this helps me? And that'll help speed up your progress too.
Oh, good stuff. Give us some hope. What's your favorite testimonial related to what you do? People that, have tried things, haven't found the solution, and a simple online course or something they download.
Oh, sure. Let's go back to that original, because most people listening to this are suffering with back pain, right? That's the most common thing that we see in our practice. So, and we'll go back even to that original example that I gave about unlocking the knees. I had a woman come into my clinic with 15 years of back pain. She was an elite swimmer in a Division I school. She had to leave her program, lost her scholarship because of it, because of back pain. No one could solve it. She gave up on her back pain. She came into my clinic actually for plantar fasciitis. And I said, wow, that plantar fasciitis must really be bothering you. She says, oh, that's not the problem. It's my back, but you can't help my back. Well, nothing gets my hairs up more than someone saying that I can't help them. So I said, well, tell me about your back. So anyway, she was in so much pain, Dr. Haley, that, if she sat down, she would require like 30 to 60 seconds for those waves of pain to stop. And if I asked her to stand up, she would have to lean against the table, close her eyes, and just breathe through her pain. So naturally, I couldn't do any testing. So fortunately, because I understand how walking affects pain, I said, look, I'm not going to do anything for you. We're going to do one thing. And it was the knee softening idea. And what I did is I actually put a little piece of tape on the back of both of her knees to make sure that she was reminded not to lock her knees. 3 days later, her pain was 75% better after 15 years of almost 10 out of 10 pain daily and no one helping it. Not only was it her back pain, but it was her plantar fasciitis too. So I say that because, and I don't expect everyone to have those kind of results, but I want people to think, because they think the longer that they have pain, the longer it's going to take for me to solve this. There is no correlation like that. You can solve pain quickly if you have the right information. And so she was my testimonial to show how simple it can be to solve pain.
Yeah, that's a beautiful thing. Rick, I want to thank you for joining us today. The solution is simple, and it's go to your website, look at the programs that are available, get the right one. I noticed you have an option to get all of the programs for still less than the cost of an office visit.
Oh, yeah. Yeah. I make it pretty affordable because everyone's paid a lot of money to fix their stuff already. I don't want to gouge them.
All right. So for those listening, we've got a coupon code for you as well. It's Fixing You, one word, no space in between, FIXINGYOU at rickolderman.com. Go.rickolderman.com is where you're going to find the courses. So use the coupon code Fixing You. I don't know how long it's going to be there, but it's the coupon code is valid now. So check it out. Rick, thank you so much. I know that this program and your programs are going to help so many people. So thank you so much for joining me today.
Thank you, Dr. Haley. I'm really impressed with your body of work. So thank you for having me on it. I'm honored.
Awesome.